So welcome everyone to our Crosswalk seminar with our wonderful projects, and Larry, Hearld, and I are going to try to go through the crosswalk with you, talk about what it is, and share with you the video from ISKI, where they call it part 1, where they basically give an overview and describe what the crosswalk is. It's a new video, hot off the video presses. They actually just sent it to us right before the seminar, so we're super thankful to them for that. Like literally, it was just downloading as we were getting on. So that's amazing. They have a little over an 8-minute video that walks us through it. And it seems like that would be the best for us all to have the same baseline of reviewing that. And they are producing a part 2 for a standard example of the crosswalk completed. That's still in production. And so we have the wonderful fortune of having Susan and Greg agreeing for us to review their completed one from last year as an example. And so the plan is for today, welcome everyone, and then watch the ISKI part 1 video overview of crosswalk, and then sort of walk through the Susan and Greg's crosswalk, and then go into breakout rooms where half of you will go with Larry and half of you unfortunately have to go with me. And then we'll just talk through your crosswalk, answer any questions that you have, hopefully have a really good discussion to come away with it with a better understanding of the crosswalk and how it applies within your site, and then reconvene to have a collective and at the end. So how does that sound? Maybe we can just for a second, just so that we can share a little bit, and as another mechanism for everybody to get to know each other from the different projects. If you don't mind sharing your name and your project, where location, the name of your project, anything very briefly that you want to share with it, and then so everybody can know each other who are here. So I'm Robin here from the UAB CFAR Consultation Hub, and one of the PIs here, and thankful to be working with you guys. Mary?
Say me?
Mm-hmm.
Okay.
Sorry.
I was sure you said Larry or Mary, but then again,
you said Mary too.
There's no Marys on the call.
Oh, I'm so sorry.
Well, I'm Larry or Mary, whatever you want to call me. I am a consultant here at the UAB Hub, and I know I've talked with many of you, most of you, I think, on previous calls, and looking forward to continuing to work with you and talk more about the Outcomes Crosswalk.
Thank you. And then we have 2 other colleagues here from our hub. Greer?
Yeah, I'm Greer McCollum. I'm a program manager for one of the evaluation units here at UAB. So I'm just here to learn. I wasn't here last year, so I'm excited to learn about the crosswalk and hopefully help some of you guys out with it. Thank you.
Kailani?
Hello, my name is Kailani Upshaw. I'm a community health educator here at UAB, and I work with the hub with administrative duties.
She's amazing, and so is Greer, of course, and Larry, and not Mary. Okay, so Greg and Susan, you go first.
I'm Susan Keglis. Greg and I are co-PIs of this project, and I'm from the University of California, San Francisco, and I will let Greg describe the project and introduce himself.
Hi, everybody. I'm Greg Grebchuk, and I work with Susan, have the privilege of that. And we are doing a study collaborating with 3 organizations in Texas to study how we can adapt empowerment, which is a community level HIV prevention intervention for young gay and bisexual men. And we are adapting it to incorporate PrEP into its core elements and studying the uptake and the adaptation and uptake of an adapted empowerment project to improve PrEP use among young Black and Latino MSM in Austin, Fort Worth, and San Antonio. Sort of San Antonio. Mostly Austin and Fort Worth.
Awesome, thank you. Karina?
Hi, good morning, everyone. My name is Karina Vila. I am from Montefiore / Albert Einstein College of Medicine. Our project is 2 models of, let me not script the name, testing 2 service models of PrEP delivery in OBGYN clinics. And we're looking to test 2 models of PrEP scale up in our clinics using 2 different kind of arms. One will be directly through providers, and the other one will incorporate a nurse practitioner and peer counselors to assist us with that in education and getting women to start using it if they're interested.
Awesome, thank you, Karina. David?
Hi, Dave Gerlotti at UC San Diego. We're doing a project with a local substance use service organization and our local HIV clinic that's actually affiliated with UC San Diego, and looking at implementing the co-delivery of injectable HIV antiretroviral treatment with injectable medication-assisted treatment for substance use disorders for people who have HIV and comorbid substance use disorders.
Thank you. Lauren?
Can you hear me okay? I'm having issues with mine. Okay. Hello, I'm not sharing my screen because my kids are here and I'm going to save you guys from seeing their little critters running around. I painted their faces this morning. But so let's see, I am an assistant professor of psychiatry and behavioral sciences at Meharry Medical College, which is one of 4 HBCU medical colleges in the US. And my project is, it's to conduct sorry, I try not to talk over him. We compete for the spotlight. It's to conduct pre-implementation stage research to inform our implementation, which hopefully will be funded as part of a K I just submitted, fingers crossed. But it's on multi-level trauma-informed HIV care at St. Jude Children's Research Hospital in their ID clinic. And so we're doing pretty much the same exact thing here in Metro Nashville, currently funded by a developmental core award with the CFAR. And so I'm looking to just kind of do this everywhere and create some kind of formula for how we show up in spaces, and using implementation science where, you know, it enables us to adapt it to the space to be contextually appropriate. Yeah, I think that's it.
Awesome, thank you. Okay, so if you guys are okay, we'll go ahead and show the 8-minute, well, it's like 8 minutes, 34 seconds or something like that, video.
Who's counting?
Not me. I'm just thankful to have it all hot off the presses. So we'll show that and then we'll reconvene. So maybe we'll keep, so it's all together. And then reconvene. Thank you, Kailani.
Welcome to the HRT implementation outcomes crosswalk.
We can't see it quite yet. Or I can't. It says you started screen sharing, but I don't see it.
Okay.
The purpose of this first walkthrough video is to provide you with instructions on how to complete the HIV implementation outcomes crosswalk to aid in either planning or reporting on your supplement project. A part 2 video will go through an example of completing it for a project. Together, this walkthrough is intended to help learners be able to input their methods and findings into the crosswalk. This presentation is not an introduction to the crosswalk. For information about how it was developed and how it can be used, please visit the Crosswalk web page on the ISKI website under the coordination tools. There, you will find background resources as well as a full webinar about the crosswalk itself. Now let's go to the crosswalk. As you know, one of the goals and responsibilities of ISKI is to collect and synthesize data across funded EHE supplement projects. This Excel form will be used to capture information about your project's intervention, strategies, and their associated implementation outcomes. The tabs along the bottom indicate where you will fill in for different constructs and domains. Some other tabs, starting with the word resource, are there to serve as quick references for specific scales or measures mentioned in the crosswalk itself. When you are ready to begin filling out the form, start at the Start tab. This first tab contains information about the purpose of this data collection and reiterates the basic instructions for completing this form. It is expected that you will coordinate with your assigned IS consultation hub to complete the crosswalk. When complete, you will submit the form to your hub, who will then pass it on to ISKI. Don't forget to include the name of the person who's filling out the crosswalk, as well as the title of your project. The second tab is where you will specify your interventions and strategies for the study. It is very important to differentiate these properly because many of the implementation outcomes are assigned to one or the other. As a reminder, in this context, we use the word intervention to mean the thing or innovation that you are trying to put into place and ultimately want to stay in place. We use strategies to refer to the actions you or another actor are doing in order to put that thing into place. Now, in the past few years, we've noticed some projects struggle with, and we ourselves have struggled with, how to tease apart interventions from implementation strategies, particularly for actions that target the patient population. PrEP navigation or antiretroviral therapy case management are good examples, where the direct effect is actually use of another intervention, PrEP or ART, respectively. Thus, we differentiate between clinical interventions, which directly change HIV risk or viral load, and supporting interventions, which help patients better use the clinical intervention. We provide more specific definitions here in this tab. For data collection purposes, please list your intervention, describe what it is, and label it either clinical or supporting. Add more rows if you have more than one intervention that you're focusing on. Similarly, implementation strategies should also be specified using the fields provided. You want to name your strategies, define them or describe what they are, list who the actor is and what they are doing, when they're doing it, and further down the line, how often or how much are they doing it. Finally, we want you to tell us more about the goals of your implementation research. From the list provided, select the primary and other goals if applicable from a drop-down. Next, we'll look at the implementation outcomes, which start at acceptability and go through maintenance. To note, the tabs are organized in this particular order to reflect a chronological sequence. An intervention usually has to be acceptable and feasible before it can be adopted, and it needs to be implemented before it can reach its intended target audience and have its intended effects. These tabs from acceptability to maintenance all follow the same structure, so we'll just take a look at one of them. First, in column A, you have your domain name from the RE-AIM framework. Now, acceptability, appropriateness, and feasibility aren't uniquely identified in RE-AIM, so they're the only ones where this domain is put. Second, in column B, you have the level of the outcome that you're measuring. Is it a site-level outcome, or provider-level outcome, or implementer-level outcome? Or is it about the recipients of the intervention themselves, or patients or clients? The third column is the research question a particular outcome helps to answer. As explained in the longer webinar, your selection of outcomes should be driven by your scientific inquiries. And as you can see in this tab, there are similar questions related to intervention and strategies. How likely will sites adopt intervention? How likely will sites adopt strategy? This is why it is very helpful to clearly differentiate your interventions from your strategies before starting to fill out this crosswalk. Now, feel free to add additional rows if your project has multiple interventions or multiple strategies. Column D lists the specific constructs or metrics that we're interested in, and column E provides some context for other considerations. The next four columns, F through I, show the recommended level of importance for each outcome by stage of implementation research. Now, this may be more helpful when you're at the planning stage and selecting different outcomes for your research project, but we could include it here for your reference, even when you're reporting. If you're unsure in which stage your project falls, you can refer back to the second tab where you listed your project goals and try to match up with a particular stage of research. Now comes the data collection fields. And for the purposes of this walkthrough, I'm going to hide a number of these fields to make it easier to see. So first up, in column J, we want to know, did you measure this construct in your project? A simple yes or no question from the dropdown. Next, from whom did you measure this construct? Here's where you start telling us about the actual people you talked to or surveyed in your project. At the site level, for example, you may be organization leaders or decision makers, while individual providers are at the implementer level. And of course, you can talk to the patient populations as well. Tell us in column N, tell us when you measured the construct. Was it before, during, or after implementation? Did you measure it multiple times? The more detail you can provide in these cells, the better. Next, how did you measure this construct? First, tell us if it's quantitative, qualitative, or mixed methods using this dropdown. Then describe your specific measure or scale used. If it's qualitative, you can include examples from your interview guide. Again, as much detail as you can provide is appreciated. And finally, in column P, we ask you to provide any findings you have related to the construct. If you're collecting qualitative data, this may include a short summary of themes. If quantitative, this may include point estimates like percentages or means of a scale. Please include enough details so that a reader can glean the gist of your results and compare it to other similar projects' findings on the same construct. Hopefully, this first part of the walkthrough has helped explain how to fill out the crosswalk with your project's information. In part two, we will apply it to an example project. If you have any questions, always feel free to reach out to your IS Consultation Hub and or ISTE.
All right.
Awesome.
Oh. Sorry, Greg, I just saw your comment about expanding it to full screen. I don't know if that was minimized.
It was fine.
Any questions at this point in time? I know we're going to go through an example, but any comments or questions based on the video?
That was very helpful, though. I enjoyed it.
Yeah, it's a good orientation, I think. You know, I think one thing to sort of, and Dennis alludes to it in the beginning of the video, is, you know, one of the things they're trying to promote with the crosswalk is sort of consistency across projects in terms of the types of outcome data that are being collected, or the measures, I should say, that are being collected. This is one of the areas where implementation science in general is trying to there's a lot of work trying to kind of coalesce some of these measures that have emerged over time. And what's happened is that just a proliferation of measures that are oftentimes one-off for individual projects has resulted in different terms for the same concepts, different concepts using the same terms, and it can be kind of a mess. So a couple of frameworks have emerged over the last decade to kind of help make sense of all these different outcomes. And one has been around for a long time that's being used here, which is the REAIM framework. So I'm sure many of you, if not all of you, are familiar with. But and then, of course, the Proctor framework is another one that's often been used to kind of organize these different outcomes. And there are elements of the Proctor framework in here as well. But you know, if you find yourself asking yourself, well, why do I have to fill this out? That's kind of the reasoning, is to kind of help ISKI from an evaluation standpoint, but more generally to make sure we're getting a consistent approach to how we're defining and operationalizing some of these outcome measures. And I think from your perspective, one of the benefits is that it does provide this kind of tool or heuristic to kind of systematically approach your own thinking about the outcomes, whether it's in the project you're using here now or down the road. This crosswalk does provide just that kind of a guided approach to saying, okay, is this outcome relevant given my stage of implementation? Yes, no. And from there, it really does kind of have this branching logic if you pay attention to it. So I guess what's next? Robin, do we want to go into the example that Greg and Susan were going to share with us or allowed us to look at?
Yes, and maybe we could show as part of the box that they shared with us, the template. I don't know if we want to show one without it filled out, maybe.
Yeah, it's probably worth it because I think I noticed when in the new video, there are some enhancements that ISKI has added with these additional tabs. As I mentioned, the resource tabs, those I don't believe were in the last year's version. So when we get into the specific example that's been filled out, you'll notice that there will be some small differences. But like Robin said, it may be worth just showing you what the new version looks like so that you have some sense of what we're looking at here. I'll share my screen again.
And I don't know, probably it's going to send this out to all of you as well, but we can include this as part of your site box for you as well.
Okay. Folks see the crosswalk, the Excel spreadsheet?
Yeah, and you might want to download to enlarge. I'm not sure if that would help.
Maybe click the X in the right-hand corner so it, well, maybe not that.
Lost it there. 1 second. Yeah.
Thank you, Greg.
Let's see if I can download it here.
It's always fun to switch and share screens and think. I don't know what we did pre-pandemic and meetings and sharing things. Hard to remember.
Okay. See it again?
Awesome.
Okay.
Yeah.
So enlarge a little bit. But as I was mentioning, these are the tabs that are new. You have a resource tab for the acceptability, appropriateness, and feasibility measures for the stages of implementation, decisions you have to make, frame as a framework related to adaptations and so forth. So you'll have a bunch of these, what he says is just resource tabs, and it's just that to kind of reference if you have questions about as you're working through these tabs where you're expected to fill in the information. These resource tabs just provide kind of some definitions and clarification on some of the concepts that are discussed here. So other than that, I think most of this should look the same and follows pretty closely with what the video is showing. You're going to start here in your Start tab. Pretty straightforward. Who's filling this out? What's the name of the project? That's pretty straightforward. The tab where you have to start making some decisions is this intervention strategy stage, and this kind of walks you through. And most of you, I think, have done this already as a part of kind of the intake survey you've done. You've given some thought to this, so hopefully this isn't too confusing or doesn't present too many problems in being able to sort of say, oh, well, my study is really in the scale up or the spread stage, and therefore these are the measures I need to look at. But as Dennis indicated, the reason why that's important is because some of these outcome measures that they're asking you to to discuss or to include in the crosswalk are driven by what stage of implementation you're at. So some would be defined as required outcomes if you're in the exploratory stage, and others wouldn't be relevant in that stage, versus if you're in the scale-up stage, some would be required and others wouldn't. So this really kind of drives a lot of the other things you'll have to decide in these subsequent tabs. Any questions about the intervention or the strategy stage? And from there, we won't go through each of these. It's probably more helpful to go through an example. But as the video was discussing, most of these are built around the REAIM framework, except the acceptability, appropriateness, and feasibility. But they're organized by level in these different rows: site, implementer, patient, and going to give you kind of the standard measure that's used for something like acceptability or appropriateness, feasibility, with these pop-out boxes that give you a formal definition. And then here they give you just some additional information, documentation, if you wanted to know more about these measures and how they were developed, for example. They give you this link. And over here is where you start getting into the place where you have to kind of do your own application to your own study. Reduce this a little bit so you can see it. So as we were saying before, if you were in the implementation preparation stage, the expectation is that you would have some measure of acceptability, appropriateness, and feasibility at the site level. Right? And if you were in the piloting an implementation strategy stage, it's recommended that you would have measures of acceptability and appropriateness and so forth. So, that's basically what the video was telling you about, and trying to kind of walk you through what you would be expected to fill out in the spreadsheet. One of the things that often comes up, and it may come out in Greg and Susan's example, is that many of you are in different stages of your projects in terms of your data collection and whether you actually have these measures. So in many cases, when you're filling this out, you may not yet have collected data, and some of this stuff is to be determined or to be collected. Or you sometimes get this question where, maybe when you started out this project, it's already underway and you didn't necessarily anticipate including acceptability. And sort of the horses have left the barn, so to speak, and you don't think you can actually collect it. And that's okay, but they want to know that. You want to basically be able to say, did not plan to collect this, will not be collecting measures of acceptability. Or if it hasn't been collected yet and they're asking you to tell them, what have you found so far? Well, we haven't found anything. This is to be determined. We expect to collect these data in May of 2022. So as Dennis alluded to in the video, more detail is better here. And ideally, you would have a response to each of these, especially if it's a required, as they say, a required measure. You would at least be able to speak to whether you have it, and if not, why not, I think is sort of the message. So where possible, try not to leave some of these cells blank. Try to explain why it is and what you may or may not have those data. Anything else you wanted me to cover, Robin, or any questions about this before we go into a specific example?
I think that's great. I think it's good. I think it's nice to see it as a clean version. This is what it looks like before we put things in, and just obviously did a great job pointing everything out.
Okay. Let me share with you the version that Greg and Susan used on their project last year, and really does serve as an exemplar. And Greg, Susan, jump in if I'm doing your work a disservice here, if I'm not capturing your work. The goal isn't necessarily go through every part in detail, but more or less just to kind of give you some sense of what this will look like as all of you are filling out your own crosswalks.
I would just ask that everyone take this with a grain of salt, because we were learning as we went, so it wasn't without its challenges.
That's go ahead, Rob.
I was just appreciating your point, and any kind of words of wisdom you want to share too, I think would be welcome for me at least, and I'm sure others. Just you've been through it, and any thoughts on doing it too as we go through it, feel free.
So as we talked about, you're going to start here, but that's pretty straightforward. So the first tab is when you go through in trying to define the intervention or the strategy stage. So here you'll see, I think this is where you first, there's still some examples in here, but so the name it, what is the strategy, or what is the intervention? And here it's, at least I think this is yours, right, Greg? This is another example.
That's right.
Prep enhanced empowerment activities, and define it. Well, what exactly is that? And you've sort of named it. These are activities that are either in person or virtual, that are designed to increase prep uptake, adherence, and persistence. And these activities follow the principles outlined in the Empowerment Project Implementation Package. And they ask you to tell, what is this? Is this a supporting or a clinical strategy? And as the video kind of laid out, they try and make that distinction, because many of you are interested in kind of these supportive interventions versus more clinical kinds of interventions. And then down here asks you to define, well, what are the discrete strategies that you're actually using or planning to use in your study? And it follows the same kind of format. Define it or name it. What is that strategy? Many of these will be familiar to you. Also, train and educate stakeholders. Well, give us a little more information. Describe it. Define it. Well, this is training on the empowerment model. Actor, who's doing this? Who is actually kind of doing this training and education? In this case, it's the researchers. What actually are they doing? They're providing virtual training. Who is this training focused on? In this case, it's focused on the HIV prevention staff. When does this happen? When does this training occur? Well, in this situation, it's been delayed due to COVID. So this is a good example, I think, where things don't always happen the way you want, and you may or may not have an answer to this that would have sort of fit normal expectations. I think it's important to sort of include information in here, even if it hasn't been delivered in this case.
Since then, I will say that we have done the training, so
good.
We could update that now.
Yep. Okay. And then dose, if it's relevant, in this case, originally planned to be 3 days, but again, this, as it notes at the time, it was in process now. But this is also just showing you here again, not all of these will be applicable to every strategy or intervention here. And if it's okay to say, well, this isn't really applicable in this case. It doesn't make sense. We're not, we can't think about dose in the case of this particular strategy. So don't feel like you have to come up with some sort of, to force an answer that doesn't make sense. I think is kind of the takeaway here. So moving over to the first tab, acceptability, appropriateness, and feasibility. Here again, this should start looking familiar. In this case, it's required given the stage at which this project was at the time. So you'll see here at the site level, they indicated, did you measure this in your project? Yes, for all three. Who were the participants? This was for the HIV prevention staff. Sample size, in this case, 9 participants. In part, I think, because that's qualitative. So they ask you to indicate, and these are all drop downs again, qualitative. What measures did you use? In this case, it's as simple as saying, you know, we used interviews with staff and supervisors. I think as Dennis said in the video, if you wanted to expand on this, you could kind of parenthetically say, you know, here's the question we used that was most directly applicable to acceptability. But, you know, beyond that, you really don't have to do much for qualitative. It could be that maybe you're using an established instrument like the acceptability of intervention measure, the AIM, in which case you would just enter that in here as well. What have you found so far? And this is a good example of what we were talking about before. You may not have results yet. So it's, you know, we're in the process of analyzing data, as Greg and Susan indicated here. I think what ISKI wants to know is if you've collected the data and analyzed them, do you have some sense of what you're finding? If not, just give them the kind of a status update of where things stand, exactly as Greg and Susan have done here. Any questions on this part? Adoption, it looks, you know, the same. It's kind of this, once you get the hang of things, I think for this initial tab, it really kind of repeats itself, and you're just kind of following along. You're starting to, I think you would start by just kind of looking at what the question is, what the measures are, and then come over here to, you know, these different categories and say, okay, which of these are relevant? Which of these are applicable for me? Am I in the implementation preparation stage? If so, it's not applicable. If we're piloting a strategy, these two I need to fill out, and then kind of keep going off to the right and looking through these.
This is Lauren. I have a question. Is the expectation that we will all complete this by the end, or is this just one of the tools that we're working through?
The expectation is that you will all complete this for your project, or one of you for your project will complete the outcomes crosswalk.
Okay. And more so that we're using it to submit back as like a data collection tool for the projects, even though conversely, people are typically using it kind of on the front end.
Maybe. Can you? I want to watch it by myself.
Is the idea that we're using this throughout the project?
I mean, yes, if possible, yes. I would say that you can definitely use this throughout the project as almost as kind of a guidepost to say, these are the outcomes that we should be thinking about, and we should be, if possible, collecting data related to these outcomes and periodically revisiting this to say, you know, these are the outcomes that we think are most relevant given where we're at in the implementation process, the stage of implementation, right? So like I said here, so to be able to periodically revisit this and say, well, we sort of said, going back to this, you know, we were expected to, we need to think about collecting data related to acceptability, appropriateness, and feasibility. Have we done that? If not, do we have plans to do that? Can we get the data to actually assess these outcomes? So I do think it's helpful as a guide or as sort of a checkpoint periodically throughout your project to see if you're on track to collect data related to these. At the end, I think it's used more for, from an evaluation standpoint, from an ISKI standpoint to say, okay, looking across, we have the standardized tool that allows us to say, how many of these projects we're looking at issues of acceptability, appropriateness, and feasibility. And what did they find with respect to these outcomes? So this gives, on the back end, ISKI a tool to kind of look across all the projects and begin to kind of summarize and synthesize information to both feedback to NIH from an evaluation standpoint, but also to kind of think about moving forward as they help future projects, how can they continue to provide guidance on the types of outcomes that all of you might want to be looking at in your projects. So does that, and it's kind of a two-pronged answer, I think, Lauren, and that I think part of the genesis was to provide a tool for ISKI to do a systematic evaluation of these projects and communicate back to NIH and improve their offerings, but also for all of you as investigators to provide a tool to help guide your own studies. And I think about it less from your standpoint as as a straitjacket to say you absolutely must collect every one of these, and if not, we're going to hunt you down. It's more of a, hey, here's a tool for you to think systematically. Here are all the different options that are out there in terms of implementation outcomes that might be relevant. And some of these might be more relevant given where you're at in these different stages of implementation. So it helps you kind of think through those outcomes again, in sort of this systematic manner.
The other thing is that it helps you to get more familiar with implementation science verbiage and approaches that although we've all proposed projects about it, we may not conceptualize our projects in this way. So it really helps you to think it through and get familiar with the jargon.
That's a good point. Yeah, regardless of your experience or training, implementation science is a tool to be able to document in a systematic way what you're doing in terms of implementation science. So, yeah.
And how do we access this latest version of this?
The latest
we'll
version?
Send it. Yeah. We'll send it to you easily enough. And I'm sure ISKI has plans to send it broadly to all of the projects, but for our projects, we can, obviously commit to sending both the video and this template.
And a shout out to UAB for making this one colorblind friendly by taking out the colored backgrounds, which the ISKI team has not done. So I really appreciated that.
Well, I will say that, oh, you're welcome. But we did convey your, not you, we didn't say who, but we did convey, and they were very receptive to that. So thank you. It's important though. Accessibility is definitely important, and I appreciate that so much. So thank you.
So just so I'm clear, it does sound like this is like a living document that you can do it in the beginning and you can kind of follow along and update it. And I'm mindful that in implementation science, so much is in the process. And so I guess which one of the versions of this document over time are we going to be expected to submit? Or do we submit a chain of these if we say like fill it out monthly or something like that, and update it as we go along? Or, I kind of just want to make sure I know what in the end of the day, it sounds like it's just relevant for the process, but I also am very mindful of what at the end of the day do we have to submit to you guys for you to submit to the ISKI project.
Yeah. So thank you for that question. I think in the end, we'll have to submit sort of your final version of this one that we'll send to you with the resources and all of that, this newest version of the template for our report for the year. So at the end of the reporting year, each of the sites will be asked to submit their final version of this. So our hope in sharing this earlier on in the year is to give you that opportunity to see what it is, ask questions, starting to input it. So hopefully it's not at the end, oh, I wish I had known, you know, what this meant before, and having to play catch up. But because it has that dual purpose that Larry was talking about, one, to help, it is the one purpose being that documentation and being able to look across the sites of, you know, what's been done, and so that we can report back in an aggregate way and systematically, you know, where you are in terms of implementation stage and strategies and activities and all of that, is also to help guide kinds of questions that you need to be, that would be helpful to consider as you implement. So initially the goal in helping you with implementing and thinking through components. And then, so starting now as best you can, I guess, is the bottom line. And then the expectation is at the end of the year for the grant that we'll submit your final one to ISKI for them to summarize across all of the projects what it looks like.
Yeah, and I'd just add to that, I think, you know, the experience we had last year is that, I don't know if it certainly felt like it snuck up on people, like we're at the end and there was this mad dash to get these outcomes crosswalks submitted to ISKI. So as Robin said, trying to get these out in front of you earlier so that you can start thinking about them now will hopefully prevent that. So there's just not this kind of rush at the end to put things together. And secondly, yeah, like I said, just to keep you guys, to the extent that you're thinking about these and keep you on track, we're not expecting you to submit these on a regular basis. As Robin says, at the end, you submit one to us, to ISKI, so that it kind of represents the final state, or at least where your project is at that point. On the way, if you're keeping different versions of it as almost as a progress tracker, that's fine. You could even, I could imagine bringing that to one of the monthly meetings with us and saying, hey, we're struggling trying to figure out how to collect data related to these outcomes, or we're really running into problems accessing the right people. Can we brainstorm some ideas? So I could imagine using that document that way, but we're not expecting you to kind of submit this as some kind of progress report, nor is ISKI.
I'll say that we actually, not say everything, but we occasionally even refer back to it during our team meetings, just kind of as a progress check to see if we're overlooking anything. So it's kind of become even though I was not a huge fan of the crosswalk at the beginning, especially since I hate Excel, I'm just gonna keep saying that, but I hate Excel for text-based chores, but it has been a useful tool for us in our team planning meetings too.
Yeah, I can relate to that. I know I saw this maybe, I don't know, 6 to 8 months ago. A mentor, I think, was one of the authors on this and shared it. And I remember thinking, this is either like the best thing since sliced bread and I'm totally giddy about it, or it's a total beast, or it's both, right? I mean, it's huge.
Yes. It's such a huge undertaking to create this, and all the resources that it has is amazing. Yeah, it's a beast, but I do think it's this amazing one-stop shop for the information around implementation science, and certainly could see this being a semester-long course on how do you do implementation science, and kind of going back to this template. So
sure.
Huge kudos to the creators for sure. Well, I see that we're, coming up on the hour, and great intention of doing our breakout groups. Maybe we'll do a part 2 of this. But I think the part 2 probably is really going to be us working individually with you and your projects and going through that. So hopefully this was helpful and, serves as a tool to come back and look at if needed. It's recorded, so we'll have this available for you if you'd like to look back on. I think the key thing obviously is going to have that part 1 video that's available to you, and then us working with you as needed to complete it. So Thank you, Larry, for everything. And thank you for Greg and Susan for allowing us to walk through with your crosswalk. And I guess we'll say bye for now, unless there's any other questions.
Thank you, everyone.
All right,
Happy New Year, everybody.
Take care.
Bye.